Hello, and welcome to this debate hosted here at Cancer Research UK in London. We're here to talk about patient centricity within clinical trials with my three guests here. Professor Johnson, why don't you begin by introducing yourself?
How do you do? I'm Peter Johnson. I'm a medical oncologist and a researcher, and I've been responsible for designing and carrying out a number of clinical trials over the years.
Hi, I'm Margaret Grayson. I am a cancer patient and I'm part of CRUK's involvement, partnering with researchers and helping to move research forward.
And I'm Christian Hebenstreit. I'm the General Manager for Europe, Middle East and Africa at Medidata. Medidata is providing cloud solutions and CRUK is one of our customers. We're happy to partner with them.
Excellent. Professor Johnson, why don't we start with you? Historically, why is patient centricity within clinical trials still a topic that we need to discuss?
I think we've made a lot of progress over the last few years in involving patients much more in research, and particularly in the UK and particularly through Cancer Research UK. We've seen more and more people with the illnesses that we're researching taking part in designing the trials, helping to work out how we best do them, helping to work out how we measure the things that are important. But that's not a universal finding, and certainly in other countries and often in the pharma sector, we've seen much less patient involvement, and so it's very patchy. And I think this stems partly from a old-fashioned idea that the doctors knew best and patients just did what was advised. And I think that's really changed. The whole dynamic of healthcare has changed, and with it, so has the way that we involve participants in research.
So we're now starting to see patients as actual consumers of the medicine as well. Does that ring true with you, Margaret, as a patient yourself?
Can I say I've just seen the organisation have a whole cultural change in having the patient voice central to looking at research design and the research projects. And that's quite amazing. Obviously, there was quite a lot of scepticism about, well, what do I do with a patient around a table? What do they bring? And the clinicians, the researchers, they're the experts. They have years of experience and knowledge. But what do I bring? What do patients bring? We're also experts. We're experts at living with the disease, at going through the treatments. So if you bring both of those areas together in partnership, look at the strength that that gives to research.
Excellent. And could you just give an example of a particular case study example which has been particularly impressive?
There was one that came from the Centre for Drug Development to our Cancer Insights panel. And that project had not been recruiting very well. But when they brought the information sheet to us as a panel, it was obvious when we looked at it that there was a lot of words, big blocks of words that needed a bit of understanding. But especially it was a head and neck study for a window study that between diagnosis and going for surgery. It was only for 2 or 3 weeks. But it wasn't obvious from the information that taking part in the study didn't delay the surgery. And that was one of the big things that needed, while that was true, it wasn't obvious from writing and reading the information sheet. So there were some other thoughts put back about the information sheets and about diagrams. And that changed, I think, the recruitment over the next 9 months for that study, but also changed the process for the Centre for Drug Development in that now all of their studies and patients look at the information sheets. And in fact, they've even gone one step further in the fact that new staff coming in have a specific involvement training pack for within their department so that they can immediately start to think, well, where and how could I involve patients?
I think you raise a really important point. The fixation on the part of the researchers is with the kind of nuts and bolts of organizing the study, and then all this terrible regulatory stuff that has to go over the top of it, and the reams and reams of information which people think they have to put into these information sheets. So you end up with information sheets which are 20, 30 pages long, all densely typed, and really impenetrable to me, let alone somebody who's coming at it in a high-stress situation with just being told that they've got a difficult to treat cancer and would they like to be part of a trial. And I think it's a question of how you change the perspective with which you come at the information. And I think having somebody who's had the illness, has been through these processes, to look at what the information is, how it's being presented, and what they're being expected to take in is really important, and it completely changes the way that you go about conveying this information. I think we do it at the moment in a really old-fashioned way.
Christian, from your perspective, do those ring true, or what are you seeing? And why now? Why are we seeing this impetus for patient inclusion now, when seemingly these issues we've had these for decades?
I like those examples, that you are bringing in, that we don't want to give a patient who's already faced with a very serious situation of his life. We don't want to give him 30, 40, 50 pieces of paper to go through. So there are better ways in order to connect with the patient.